Doctors of Reddit, if free healthcare for all happened tomorrow in the US, what pros and cons would you see in your profession from day to day? Jodley once said, as a cancer doctor, there are many people who avoid going to the doctor due to fear of cost. Some people do not get treatment for cancer at all. Some people wait until it is late and their cancer has already spread. But most importantly in my mind, many people do not get the routine cancer screening or tests done when they first have symptoms. It is true that even those with insurance sometimes have other barriers to healthcare, including things like low health literacy, denial, alternative treatment preferences, misdiagnoses, etc. But affordable access to healthcare saves lives and costs less. As an example, my landlord in NY was in the Army Reserves, and just before his time was up he was called in to do 2 tours in Afghanistan. He is currently self-employed as a plumber and owns several rental properties. Several years ago he noticed a small lump on the side of his neck. He ignored it at first, but then when it started to grow he made an appointment with his PCP at the VA, who ordered an ultrasound, then a scan. It was eventually biopsied and shown to be cancer. He was treated with radiation alone, and 9 years later he remains completely cancer-free. Had he not had health insurance, as is the case for many self-employed people in America, he may not have had a PCP, or the cost may have caused him to delay care, or delay scans, etc. If he had waited he very easily could have required extensive, invasive and disfiguring surgeries, months or years of chemotherapy, feeding tubes, complications, etc. Not only will this have cost much more to our healthcare system, he also might be dead despite all that. Having access to free healthcare quite literally saved his life, and was much cheaper overall. TLDR, cancer sucks. Cancer sucks much more if you were uninsured. Alcoholic man said, I had a coworker at a new job who had kidney failure and was waiting for insurance to kick in after 90 days to go to the doctor. He was in pain every day and was limping. He was 28 at the time. Now when I had a recent comment talk with him on a Facebook post about universal healthcare, he was against it firmly because his money would be paying for other people's care. And I was like, motherfucker, you were on the other end of the stick, and now that you make almost 6 figures working 10 hours a day you say fuck them. This was at a car dealership SMH. Projerviler said, hi, friendly local PCP here. While things may vary according to your state, insurance and provider, I try my damnedest to make sure recommended preventative care gets done for my patients, and usually I don't get pushback from insurances. Good luck out there. American healthcare is pretty wacky, to put it lightly. Found in Wonderland said, do you have insurance? The first place to start would be with a call to them, or pop over to their website and find a list of primary care physicians in your area that are in network. Nothing sucks more than making an appointment with a new doc, getting all nervous to go, and then getting there and being told they don't take your insurance. Once you have a list of doctors in your area who accept your insurance, start Googling. It also helps to know what you might like in a doctor. For example, would you be okay seeing residents? If not, you may want to find a PCP that doesn't teach. Pros are you don't see residents, but cons are that it may take longer to get in to see them. Do you prefer a man or a woman? Some people do prefer to see a doctor of the same gender, some people don't care. Do you prefer a chattier doctor, or one that's more to the point? There are sites that have reviews of doctors. Keep in mind that not a ton of people publicly review their docs, so it's possible that there won't be very many reviews. I know you didn't ask for a 30-step guide to making an appointment, but TBH, I get this question so often, and if anyone reading this needs some steps to help them, here they are. In case anyone reading this is wondering, yes, making an appointment with a new doc is annoying. No, they're not trying to be annoying on purpose, but legally there are a ton of things needed to enroll you in the doctor's care. Source: work in a few different roles in healthcare. Found in Wonderland said, you call and schedule a yearly physical. As you get older it gets more and more important to have a yearly, honestly. That's when most of the preventative stuff happens, like referrals for colonoscopies or mammograms once you hit that age, or even if you're younger you can start a relationship with a doctor for any ailments that might pop up. It's much easier to get an urgent apt with a doctor for some issue you're having if you have a pre-existing relationship with the doctor. The way they know your baselines, they know any pertinent medical history, and they can make suggestions based on what they know about you. Because I'm in healthcare, I've had the privilege of having really great relationships with my personal doctors, but as someone with some chronic issues, it's been invaluable to the management of those issues, to the point where I can live a pretty normal lifestyle, to have doctors who know me, who know what I've tried, and who I'm able to trust to give me suggestions that will be helpful. ESCAP artist said. Insurance still routinely denies a lot of preventative screening, even if the doc thinks you need it. The death panels that conservatives freaked out about when socialized healthcare plans were discussed years ago already existed. They're part of private health insurance where your life is balanced against a matrix of surviving, your continued payment of premiums, how much a hospital will write off, and profit. Government may not always be the best solution, but they aren't weighing your expensive treatment against a quarterly report to the shareholders. Tolkien about said. Yes, but that isn't how us healthcare works. For instance, when gastric bypass first gained popularity in the early 2000s for weight loss surgery, many insurance companies would not approve it. Why? Because the average American changed insurance providers every few years and a current provider would not see the benefit of an expensive operation. The ACA has made things much better, but as a whole the US system is designed to maximize procedures because that makes the most money, not preventative care. Source, Surgeon. IX 6677 said. One of those death panels killed my grandmother. She had COPD and emphysema and they dragged their feet just to let her get tested to see if she was a good candidate for a lung transplant. She finally got bad enough and got the appointment. She died the night before the appointment. She suffocated it to death because some dickless CEO didn't have enough yacht money and they were hoping to wait her out. She was only 54. Parasitic capitalism is an immoral cancer on this Ponzi scheme joke of a country, and the doctors that support this system will burn in hell along with the insurance companies and the bought-off congressmen that continue to prop it up. Dava from above 85 said. Even with free healthcare, some people don't go to doctors. My oncologist said it's quite common, especially with young men, to ignore it. I'm in the UK. I'm one of them. I had a small lump on my testicle and ignored it. It eventually spread to my liver and lung. In 2018 I walked upstairs, couldn't get my breath back, got rushed to hospital, spent the night, then got transferred to a cancer hospital where I spent 3 days while they decided how best to treat me. I was then transferred to a specialist cancer hospital called St. James where I was put on oxygen for 2 weeks because my O2 were dropping down to 60-70%. Doctors didn't think I'd come. Started breathing okay, then had 6 months worth of chemo, 3 different types every day for a week, then one type the next week. About 6 months after my chemo I had an operation where I was given a 200/1 chance of dying. They said it'd be about 6 hours. I was on the operating table for 10 half hours. I had my lymph nodes and a testicle removed, and the main vein that connects your heart to the lower body replaced with one from a cow. Dava from above 85 said. In 2019 I had 40% of my right lung removed. I then had another op later the same year to remove a bit more and some bits at the back of my throat. Luckily the throat weren't cancerous. Then January this year I had 20% of my liver removed to get rid of 2 tumors. One they got out completely, the other they missed a tiny bit. But at the moment my CT and blood are clear. If it does grow the surgeon will operate again. I've had bleomycin chemo so can't have oxygen, so it adds a complication. If I hadn't had been stupid I would probably just needed chemo and the testicle removed, which would have saved me a lot of trouble. But it's my own fault. If anyone thinks something's odd, go and get checked out, don't leave it. The longer it's left the harder it gets. Sorry it's long, I want people to see what can happen if it's left. Edit, thanks for the silver, never had an award before. Rage 2097 said. Not a criticism of you, and you should absolutely use the healthcare available to you, but waiting until the government will pay is an insane way to run things. And to be honest, if Medicare kicks in with decent healthcare from 65, what exactly are the insurance companies paying for? I know younger people get sick too, but healthcare usage skews massively to older folks. The NHS budget in the UK, which covers everyone who wants it cradle to grave for pretty much all non-cosmetic medical care, costs £3,200 a year each with no deductible. Paid for from general taxation, £212 billion budget divided by 66 million population. I just can't understand the extent to which us insurance companies get away with ripping people off. Unicorn Dog Applesauce said. Please stop ignoring it. Even if you have no insurance, you can't put a price on your actual life. I know it feels awful if you have to go into debt for your health, but honestly, the sooner you figure out what it is, the better. Even if it's nothing to worry about, you can have peace of mind. Please make an appointment. Seb B.A. said, I am not a doctor, but I live in a country with free healthcare, and if we think we have a problem, it pretty much comes down to if we are too lazy to get it checked out. If a country like America was to get free healthcare, it would mean more taxes, and the population would need to change perspective as well. The citizens would need to think of it as I pay this in advance to prevent any future injuries for me and my fellow countrymen, instead of thinking I'm not going to pay for somebody else, and why would I need to pay when I'm not even injured? Suchuanjo said, the pros of mitigating what's best for the patient without having to worry about what's going to destroy their finances really outweigh any of the cons I can think of, to be honest. Outside of people with low health literacy or outright ignorance, the biggest barrier to getting routine screening and follow-up is cost. Same goes with medication. Seriously, insurance formularies can change up to 3 times a year, and when they do, your $5 pro air inhaler is instantly $170 unless I switch it to a $5 Ventolin inhaler. Sometimes it's just as simple as putting substitutions permissible on the script, but not always. I'd honestly and genuinely like to hear from anyone in primary care who can think of any substantial cons to universal healthcare that would outweigh the benefits. I have to say that I really appreciate all the reasonable discourse I've received, even if we don't see eye to eye on the matter. It's really encouraging that Reddit doesn't always have to devolve into vitriolic cynicism. However, if you've read some of my responses, you'll see that I have a lot of patience and I live in a small area. Today was kinda a fluke for me, as I usually don't have this kind of time to dedicate to responding to people on Reddit, even if I try to stay semi-active around here. I'll probably wind down in responses right now, but I'll try to chime in whenever possible if anyone feels like they have a heartfelt question and cares about the feedback of a humble, rural family doctor. Haha. Thanks everyone. The Dog and the Dragon said, fun fact, it's technically illegal for pharmacists to change between Ventolin Pro or Prevental, or between generics of the same, because they're not AB-rated equivalents due to some clerical nuances. We also can't change tablets to capsules or vice versa. The differences between these medications can literally be hundreds of dollars. We do anyway. 'Cause damn the man. Suchuanjo said, oh yes, I forget about the birth control formulary changes. Those can really give me a headache, especially when a patient gets a $100 bill because the insurance company wants the same med just from a different manufacturer or something. Sometimes it'll just be a slightly different combination of estrogens and progestins. This one gets pretty frustrating not only for you, as the patient, but for me as well, because birth control isn't really something that should be stopped abruptly, and pulling the rug out like that can lead to patients having lapses in their birth control. It's really quite upsetting. Ruthifer 123 said, I also find this odd. Given that the cheapest way to prevent having to deal with larger social care bills for government is to insure birth control, then I don't get why it isn't free. I think I've bought condoms maybe twice in my life. I was probably just being too energetic in my youth. Otherwise, I've gone for my ST check and picked up condoms, or been on the pill, injection or Myarena, all of which were free. I also didn't require any parent involvement in this. The first time I went on the pill, I went to a sexual health clinic near my school and signed up. I should have just gone to my GP, it was closer. I was paranoid at the time, but they'd tell my parents. Ruthifer 123 said, I totally agree, and sorry if I came off as soapbox-like, but economically for the country, birth control makes more sense. I do understand there are a lot of very conservative Christian influences in these things in USA. I just find it odd. I should never have been paranoid about them telling my parents, especially as my parents didn't care and told me they'd rather I did it in the house than somewhere unsafe. They were very pragmatic. It was just the teenager issue. I did have to talk a number of friends into going on the pill or to the clinic for things. There are a lot of clinics for under 25s in London at least, which meant that the treatment was more targeted towards us at that age. And that was quite good, and I'm not sure would have gotten as targeted immediate support from my GP. Even when I was in my late 20s working in a medical school, I still found it more convenient to go to the on-site sex clinic than a GP. It was next to my office and they offered everything I'd want in one go by people who did it all day every day. I'd do my standard full ST test and they'd give me contraception, and a smear test. Everything in my lunch break next door was great. Michelle 11235 said, I know this protocol. My doc writes me an asthma inhaler RX. It goes to my pharmacy to process. If it comes back as a couple $100, the next person I call is my insurance. I have to ask them what they will cover that is equivalent. They tell me, then I tell my doctor write me an RX for this medication because that's what my insurance covers. My DR does. It goes to the pharmacy, and then the price goes way down. So in all of this, it isn't my doctor or the pharmacist even, but my insurance carrier who gets to dictate what medication I ultimately get. Maleficent List 8583 said, the plan that our employer picks, and which we lose if we leave the job. Being unemployed basically means being uninsured for the vast majority of people. And when pre-existing conditions were a disqualifier, it meant that if you were unemployed and previously diagnosed, you couldn't get coverage again for the condition because it was pre-existing. The whole insurance industry is trash and we need to get rid of it. Suchuanjo said, while there is certainly some concern for the private practice docs and overhead, I would argue 3 points. Since Medicare/Medicaid is the bread and butter for primary care, an M4A platform shouldn't significantly impact a family doc's take-home at the end of the day. Most projections show it wouldn't impact it. There's no reason an M4A platform should impact a primary care doc's ability to perform concierge medicine, if they chose. Which leads me to the old idea of hanging a shingle and practicing medicine by yourself in a cozy, private practice is dying, anyway. While multifactorial, many practices are either being swallowed by large corporations or are converting to small group practices made up of 3-5 docs who open their own office. These offices are also converting to either hybrid practices or concierge only, neither of which seem unreasonable to maintain even in an M4A structure. So, while I understand your doc's reticence with coming to terms to universal healthcare, I wouldn't say their long-term goals are realistic or necessary to hinder any kind of universal platform. The Quick Trigger said, as I understood when I worked for Medicaid, the big issue besides the death spiral was the sunken costs of the ER. Most hospitals lose money on the ER because uninsured people or underinsured people don't get preventive care and end up not being able to pay the bills. Ideally, more people getting preventive treatment means less ER costs. Providers see more patients because more people get help before it becomes life-threatening. Even if the reimbursements are lower, the theoretical increase in volume and the reduced ER costs for hospitals should balance things out, right? Deja Blue said, even with that, it puts burden on pharmacies and nurses and prolongs prescription fulfillment times. There is another conversation about written doctor's orders which takes up doctor-nurse time. In my case, he is a doctor, he wants me on extended release metformin. To do that he has to write an order every time I get a refill. Or when I got my blood glucose monitor, what a rigmarole for a $20 medical appliance device. Insurance covered the $100 strips and lancets, but we waited for a month and no word on the meter, so my pharmacist dug up a free AccuCheck meter coupon, because hell yeah, they want you to buy their $100 month strips. Thank God for doctors, nurses, and pharmacists for always going above and beyond for such minor, common, daily medical treatments and putting up with this stuff. How the hell do they do it? Maybe they should collectively be called patients. I guess they aren't because they have none left, lol. Cheers. Prochrist1 Natrix said, tomorrow? Okay, let's have fun and be very literal about this. For context, I'm an emergency physician in a smaller community, so I'm accustomed to seeing a mix of people who are privately insured, people with Medicare/Medicaid, vets from the local VA population which is unusually large, and people who have no insurance. If healthcare for all popped into existence tomorrow, it would be a huge mess. The system would reel with the shock. Primary care, particularly, would both be blessed to no longer shoulder the burden of underinsured patients needing primary care, and stressed. Single-payer systems very quickly understand that investing in preventive care saves dollars, so those systems build structure for providing health education, diet education, exercise education, gaining everyone screening tests and awesome early diabetes care. That's a lot of catching up, because here with our current system we disincentivize lots about management of chronic illness. It can be hard to get nutrition or diabetic test strips or blood pressure medication covered. Prochrist1 Natrix said. From what I hear, in single-payer systems, if a patient inaccurately triages themselves, the system gains permission to redirect them. I'm currently the safety net for how messed up access to care is. I legally cannot refuse to see that one guy who shows up for athlete's foot by ambulance. Or a rash that's been the same for 4 weeks but she's been unable to get into primary care. Or the guy who ran out of diabetes meds. Or the ankle that was sprained yesterday but still hurts. I understand my role. I understand why this safety net is important in the US. I would be very happy to instead be able to tell these people you belong at primary care and poof you have the ability to get in within a few days, or you belong at the sports clinic and poof you can go there tomorrow. I do love my job, but I do spend a lot of time patching holes in access to care. My training is in resuscitation, intubation, reducing dislocated joints, sewing lacerations, diagnosing sepsis or new psychotic breaks or anaphylaxis. I currently spend about a quarter of my day hating the US system's barriers to effective primary and preventive care. Not my training. Not a good sign for the patients that they've been forced into that place. Not the smoothest way to navigate the system. Sadly, it clutters up time I could be getting to the next emergency patient. I also spend a fair bit of every day talking to frightened or angry people about their healthcare costs and battling the effects of those costs. A young woman whose prescribed insulin was too expensive and she felt uncomfortable advocating for herself, and instead went into a diabetic coma. Outcome was good but her IQ admission venous pH was 6.68, the lowest I've ever cared for that lived. I thought she was going to die. Her mother hadn't known she was going without. Prochrist1 Natrix said. People want to know the cost of that CT scan to diagnose kidney stones. There's no way for me to possibly know that. It varies thousands of dollars between plans. I ache around this. It's terrible not being able to engage in transparent discussion. Until we go single payer I will never be able to tell a patient how much a gram of acetaminophen costs for them. For many, it's zero, and a great help in multimodal analgesia. For some, it's some stupid inflated cost. I don't know. I can't have an hour-long insurance company call with each patient. I need to see 2.5 per hour including time spent talking to specialists, doing procedures, etc. I would sincerely love to not do that stuff anymore. No more my meds used to be covered and no more I couldn't afford the cost of treatment but now I'm worse. I think it will be a painful, bumpy transition to single payer, and I may indeed take a pay cut, though I think that's not as bad as some make it out to be. Aussie and Brit docs as compared to their peers do okay. I feel very strongly that our nation needs this. I feel it deeply and the lesson is engraved more deeply every time I go to work. Beline said. People want to know the cost of that CT scan to diagnose kidney stones. The way copays work for this is stupid too. As a follow-up to several bouts with cancer and several surgeries, I get scans every 6 months. I used to get an MRI abdomen and pelvis with and without contrast, and a chest CT. The MRI takes the better part of 2 hours in the machine. I have to change into a hospital gown, there's an IV in my arm, the pump for the contrast itself, and 3-4 red techs. So it's costly. The CT takes about 5 minutes, and I do it in street clothes. If I get all of the above scans done at the same time, in the same facility, my copay is $40. Since I've been clear for 3 years, my doc said I can bump the MRIs to yearly, but still needed the chest CT at 6 months. The copay for just that was still $40. My book Sarah said. With my first child I had a C-section and recovery went pretty poorly for me, including readmissions to the hospital. In the months following I was billed numerous times for things that should have been covered. At least a half dozen times. I often had to call the insurance company and then call the hospital billing office and then call the insurance company back. Waiting through endless rounds of press 1 for, press 2 for and your call will be answered in the order in which it was received. Between caring for a newborn and dealing with my own life and chronic pain, I did not have time to make those calls. But because I did, ultimately every single one of those additional bills was eventually paid by insurance. We're talking a total of around $3K if I remember right. Imagine if I had just paid those bills as they arrived. My spouse is convinced it is a deliberate health end scheme to bill us for things that are actually covered as part of our plans because most of us probably won't have the time or energy to fight. Thuaoff said. It would be a game changer. The biggest positives would be that my patients can finally afford to come see me consistently. They won't have to choose between the insulin I'm prescribing, the lab I'm ordering, or the specialist I'm referring them to, in things like paying rent or buying food. Better yet, they might actually come to see me to get some real preventive care, so I might be able to find the tumor in their colon before it decides to metastasize all over to a point where the only treatment they can get is comfort care. Or they might not feel like they have to cram all their complaints into one visit because they can't afford another copay for a separate visit, even though a separate visit would get the best, highest quality evaluation of your complaint. All of that in turn makes my job easier to do and less stressful. I'm no longer having to take into account the cost of what I'm doing, not that I ever really know that anyway, and instead I can focus all my energy to figuring out what is wrong with you or the absolute best way to manage your diabetes, instead of rushing because I'm running behind after taking 10 to 15 minutes calling your insurance company to justify why you need a sleep study or a stress test. I went to school and dedicated years of my life to training to learn how to take care of people, not worry about the business of it. AskReddit said. It certainly wouldn't be all sunshine and rainbows though. As others have mentioned, an initial transition would mean a large influx of patients into primary care clinics, especially in rural settings like mine, where some of the more significant barriers to care currently exist. The primary care system is already strained as it is, so this could certainly lead to increased burnout, although I've also seen burnout defined by some as really an end product of moral injury, and if you are improving working conditions you may see less burnout. There would likely be an increased focus on reimbursement to the primary care level though, so I wouldn't foresee significant decreases in salary to those in my position. Other specialties may suffer to some extent though. However, you certainly couldn't have Medicare for all, at least in the format Medicare exists in its current format, and expect it to be anything other than a disaster. The reimbursement is just too low. However, if you don't have the obscenely inflated charge rates by private insurances to hospital systems and you reform the pharmaceutical company system of inflated prices, it could work okay in its current form. I think it's the only logical outcome and way to run a healthcare system. There's a reason other countries do this successfully. It would be incredibly difficult to change our system to something based on a universal coverage option from the government due to how entrenched our current system, and a significant portion of the economy, is into the current setup. Without careful planning, there would likely be a short-term backfiring effect with closed hospital systems clinics, which would reduce access to care. But it's the right thing for us to do.